Today, the NHS is coming together to set out an optimistic new direction for health and care in this country. Keeping all that's great about the health service, so there for families at times that matter most, when our children are born, when our relatives are sick or frail, and all the years in between. But also explaining how we can get to an even better place as a nation, both in terms of health and in terms of care. The NHS has come a huge distance. We've got a far better health service now than we had 5 years ago, 10 years ago, or even 15 years ago, despite the huge pressures. Treatments have improved. Cancer patients now, most cancer patients survive for more than 10 years, whereas 40 years ago it was 1 year. Early deaths from heart attacks and strokes are way down by 40% compared with 10 or 15 years ago. And waits for hip operations or cataracts or other routine surgery that used to take up to 2 years, now the average wait is under 10 weeks. So the health service works and it has come on a huge distance. But there's a lot more that we can do for the reasons that Bruce just set out. And we know what needs to be done as a health service and we're determined to do it. We've got a growing country. The estimate is that 3 or 4 million more people will be living in England by the end of the decade than they are now. And this morning we're here in Newham in East London, a growing part of the capital, where you can see that growth right before your very eyes. We're an ageing country, we're living longer, and that's a good thing. But the consequence is we've now got more people who are of retirement age than of children, and more long-term health conditions rather than problems that just need a quick fix. And yes, services are under pressure across the National Health Service. GPs are working incredibly hard. More people are needing to go to A&E departments. Staff are pulling out all the stops. So today we're making our case for the NHS to the nation about what the next 5 years could look like. Our argument is that we've got to make progress on 3 fronts. We've got to get much more serious about preventing illness in the first place, taking our own health seriously, both as individuals, families, and as a country. Second, we've got to change the way in which services are being provided to recognise the changing needs of our patients. And third, yes, we do ask the next government to commit to support us in that journey to sustain the comprehensive, needs-based, compassionate health service that the people of this country want.